When I was looking for a residency program, I wanted to find a program that would support what I wanted to do in the future.
I wanted the research opportunities. I wanted to be able to give something to the medical community in writing, in publications, and in expanding the knowledge that is medicine.
I need a residency program with good clinical practice that can get me into the kind of fellowship to do exactly what I want to do in future.
I'm interested in kind of systems and innovative solutions and those kind of big picture things.
I'm very interested in health system issues and cost of care, some innovative things to reduce ordering of those tests.
Because serving my community is a priority to me, I definitely wanted to choose a program that would allow me to continue my work as a community health advocate.
I knew I wanted to go into primary care from the start, and I really wanted a place that celebrated primary care and promoted academic primary care.
When I got here, I was directed towards different faculty members that had an interest in international health. One of them is Dr. William Greenow. He discovered the cure for cholera.
Being part of Johns Hopkins is in itself this phenomenal thing because you have the most intellectual minds of medicine coming up with the most up-to-date research and the most innovative ways of treating and caring for patients.
I think that feeling that you're part of something greater, I think it is that culture that makes this place strong.
People really come up to me and say, hey, what about this project? Hey, I hear you're interested in this. I'm asked that on a daily basis by 5 different powerful attendings who care about my future.
We're going to put these stickers on your head.
One of the things that I really liked is that we have a full-service hospital with everything available here, but it still has a community hospital feel. And within 3 to 6 months, I was able to get to know everyone from the president of the hospital down to the janitorial staff. And quickly I had names and faces of people who could help and were willing to help.
Because we're Hopkins, we get the specialty referred in care, so you do get the very interesting cases, but you also get the local community, which is kind of your salt of the earth folks. And then you get refugees and immigrants from other places who come with all kinds of things you've never seen before.
Possibly step a go in. This program has allowed me autonomy. I've been able to get to know my patients very well and also get to know the surrounding community very well, which ultimately has made me a better physician.
Your wound looks better though, by the way. Kind of these home visits that the Bayview community talked about during my interview was the first time I ever heard of it. Something that sounded good on paper, but doing it, it's what made me realize, wow, this is the program that I've always wanted to be in. The patient felt like family. She felt like a part of this larger, bigger picture that Bayview aspires to achieve.
When I first came here, I was deciding between primary care and international health. And people kept on telling me it's impossible to combine the two. Looking back, I think that it was almost like a godsend for me to be here. Because I was not only able to find my passion, but I found people that supported me along the way, that allowed things to happen the way they were meant to be.
Many of our residents goes out to do international work. We get funding, usually through the School of Public Health, and they go and they do this work and they come back. And I think not only does that resident learn, but they bring back that knowledge and really teaches us a lot.
What I didn't expect is that how much there is to learn from each individual that you care for, and Bayview has really helped me see that. And part of their motto is that every single patient matters. Doesn't matter if you've seen the same condition 85 times, doesn't matter if you've seen this patient 35 times. Every individual encounter matters.
They give you individualized attention, which allows you to go along whatever path you choose.
I think we all enter medical school very idealistic, with these high ideals of what kind of doctor we want to be, and compassionate and empathic, and What I think I can honestly say is now I'm starting my third year, and 2 years in, I think I might be even more idealistic than I was when I came in.
You walk into this program having an MD, but you're going to leave this program being a doctor.
I wish there was a speaker somewhere that one could shout to the world. The power of this program is the culture.
The heart of Bayview will remain in every resident that has trained here.